Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to discuss the news and trends that are impacting the space today. Joining me today is Hayley Burgess, SVP, Provider Surveillance and Safety at Inovalon. This episode is part of our mini-series where we look specifically at 2026 and what our internal thought leaders predict will be top of mind in the healthcare technology space. Thanks for being here today, Hayley.
My pleasure. Thanks for having me.
Let's start today with looking at what are some of the top challenges clinical teams and pharmacists are going to be facing heading into 2026.
A few of the top challenges that come quickly to mind are workforce burnout and a desire for workflows that are efficient, that are part of your everyday work, that are built in to make life easier, easy to do the right thing, hard to do the wrong thing. The other frustration that we often hear from clinicians would be the amount of time spent on documentation in their workflow. So anywhere from 25% of their time is spent looking for information through the digital systems. It may take 3 to 4 different systems for clinicians to find the right patient information that they need to make a clinical decision. And that certainly leads to frustration. It can lead to harm and errors in the healthcare system. And we know from the literature that 1 out of 4 hospitalized patients will experience an adverse event during their inpatient stay, and that 25% of those harmful events are preventable. And so that is a place where I believe the workforce has top of mind. And those biggest buckets are around medications, healthcare-associated infections, and nursing-sensitive measures. So think falls, pressure ulcers are still a problem.
These are pretty real challenges. So what would your advice be as far as number one thing that they could do to be addressing some of these?
Yeah, the number one thing that comes to mind that we need to address as a healthcare society is the data fragmentation element. As we're bringing in all this rich information and documentation, having a source of truth for clinicians that make their workflows much easier than they are today, and leaning in on artificial intelligence. How are we truly going to optimize in the healthcare space automation of workflows, automation of documentation, and we're making progress in that space, but we all want to move faster and we want to do it in a safe way. So having governance, respectfully understanding the impact downstream to patient care is going to be top of mind for all of us.
Absolutely. Tell me what a strong data strategy would look like to help clinicians have more information, but without having to really dig through all that data.
A rich data strategy is your AI strategy. Having that foundation of data that's clearly mapped, that's curated in a way that clinicians can digest it to make critical clinical decisions is imperative. And ways to do that could be with clinical surveillance and with advanced analytics and business intelligence. Ideally, what Inovalon software brings to the table is this beautifully curated data set that creates, one, workflows for clinicians, AI, rules-based, incredibly transparent, where clinicians know exactly why the rules are firing, why they're creating this workflow, because it's going against their policy. Something has happened to this person or is in the midst of happening that is going against what you have said, healthcare system, is your policy, and creating an infrastructure where data can be used in such a way to make clinical decisions in real time, and also automating as much as possible on the documentation side to make it very simple to focus their time and efforts directly on the patients. And that's where we want to be as clinicians. We want to be at the bedside caring for people and automating, using effective, efficient workflows, optimizing your data from this fragmentation to a very curated way is absolutely the future of healthcare.
So tell me, to wrap up today, what is your number one new solution that you're the most excited about?
For 2026, we have a new solution coming in the ambulatory space. So 70% of care happens on the ambulatory side for Americans. And it's so important to have tools all the way across the continuum. So we have an ambulatory surveillance tool that will fully launch in January of 2026. And that is exciting to me because we're able to pull in, because of the power of Inovalon data, pulling all of this rich information into one workflow for clinicians to understand that trajectory of care, how the individual has transitioned across care, understand percentages of adherence, how likely are they to adhere to their medications, therefore allowing the clinician to create really customized plans of getting to that true precision medicine for our patients, which is what we want to do. We want to understand what's holding them back from caring for themselves in the best way, and then what are the right medications, what are the right preventative medicine actions that we can protect them for long term. Like, how do we plan those things out, having the right data at the right time? And the ambulatory side of care, it's very easy to lose sight amidst all the data sources that we have, and then also the fragmentation of care when you're seeing multiple providers in multiple locations. Truly the power of that data, pulling it into one space, creating, again, these really streamlined workflows and pushing information in near real time to the clinician so they can care in the best way for that patient. That's what I'm excited about in 2026.
Absolutely. And a lot of these conversations can get kind of lost in the technology and the data side, but remembering that the patients are really at the heart of everything we do is so important. So, Hayley, thank you so much for being here today. I really appreciate the time and the insight.
A pleasure. Thank you.
And thank you to our audience for tuning in. Be sure to check out our other episodes of our Trends and Predictions miniseries.